Resume recording. So many things going on. I got 3 screens going on trying to manage everything. So my business has been for the past 14 years focusing on seniors in transition, in particular to real estate. And the designation of accredited senior agent is a designation within the real estate industry where we get training on how to work with older adults as they transition through the process. Now, I know we have a couple of realtors on the site as well, or on the call. So welcome, guys. And I'm sure you're familiar with the ASA. So with the ASA, as I was doing work with seniors, there was something that I needed more out of the effort that I was doing. And I approached the organization, and I had asked if there was a higher level of education or designation that could be offered. And with that, I began working with the ASA division, and we created the Master Accredited Senior Agent designation. And the Master ASAs is an elevated education level for realtors specifically working with seniors. From there, I began networking. I built my network of service providers that would help me and my clients. I started doing more and more work with retirement homes and more work with seniors in that transitioning process. And part of that, I became to realize that in order for me to be able to offer my clients more than just real estate, I would have to actually break away from the real estate itself and open up a company. And that's where I broke from the real estate section and opened up Pivotal Aging Innovations with another business partner named Denise Bedard. And you can get information on Pivotal later on. And as I was beginning to work on additional programs, we had the opportunity to actually acquire the Accredited Senior Agent Training Program. And we now own that program, and we have expanded that program to include other professional services who are looking to work with seniors, and they can now come into the Accredited Senior Agent Designation program and begin working with us and be recognized for additional training. So we're excited about that, and I know there's several people on the call that are quite familiar with it. And as I continued learning and developing and networking, I began realizing that over the past 5-7 years or so, there was a lot of those organizations that I was working with that weren't in business today. And the challenge for me when I was working with my clients was, how do I maintain those relationships with these other professional service providers, whether they stayed in the business or there was new ones coming in. And it was very challenging to kind of maintain that. Lori, I'm sure you'll understand exactly what I'm talking about. And another aspect of that was when I was consulting with my clients, there was an opportunity for me to connect with them when we were looking at trying to get them into a retirement home. So that transition into a retirement home. And the challenge there was the information that was out there wasn't giving me all the information I needed in order for the families to make an informed decision as they transitioned. So it was very challenging, and it maintained that. And this past 2 years, I was able to meet up with Esther, and Esther is going to introduce herself shortly. And for those of you who know Esther, you know that she is the owner of SeniorCareAccess, Inc. And the relationship began on that first meeting. So at this point, Esther, why don't you introduce yourself and talk about SeniorCareAccess, and then we'll come back to how we came together. Yeah, Esther, did we lose you?
On.
No, can't hear you, Esther.
You can't hear me now?
There we go. Now I got you.
Now you can hear me? Okay.
Now I can hear you.
So I was a social worker, I worked in a hospital in Toronto for about 12 years. In that time, I began focusing on working with seniors. I actually became the social worker on the transition floor, where we actually developed a transition program for people that couldn't return home. And it became painfully obvious that what I didn't know about were the private sector facilities out there, which were more and more becoming places we were turning to help house seniors that could not return home. So I set out to create a document for myself that would have all the retirement homes out there in it, in my catchment area. And so I created a book 23 years ago, and it was a book on Toronto and retirement homes in Toronto. Over 5 years, that grew. I continued to work at the hospital, and that book grew to become Ontario-wide. I eventually had to stop working in the hospital to focus full-time on the book and the website that I created from it, which became known as SeniorCareAccess. So for many years, I've been doing SeniorCareAccess full-time and building the housing database as well as a resource database. But a few years ago, what started happening was people were approaching me and saying, you know, we want more. We want to know homes, not just homes that are paying to be part of a resource. We want to know other homes as well. Can you help us with this? So I started thinking, are we doing things, can we do things better? And so came up with the idea for a website that had an unbiased database, so a database where every retirement home out there would be part of it. However, instead of them paying to be part of it, the users would be members and would be the ones that would purchase the opportunity to access this data. Because the ongoing problem with getting people on board for any kind of a database where there's money involved is there's that whole piece around, I don't want to pay to be there. Mm-hmm. So this took that away and gave us the opportunity to make something that that had everything in it. So fast forward a couple of years in terms of development, and I met Paul, and we very quickly recognized that we shared a lot of common goals, and that we saw things the same way in terms of the need out there and the opportunity to open things up and provide information that had never before been provided. And so over the course of probably about a year, we call it our dating phase, before we formed the new company, we expanded on that original thought that I had and the original concept of the site. And we expanded it to include every kind of housing opportunity. We included a section on, as you'll see, on resources, and another section on consulting. And that's what you see before you is the culmination of really over 20 years of my expertise, over 10 years of Paul's expertise, as we came together to create this really exciting new concept that nobody else has done before. It's been challenging, it's been exciting, and we're really, really happy that we were able to pull our experiences together to make something like this. So we are going to tell you all about it today. Yeah.
So let me continue with that. So that's the introduction of who we are, the people behind the program, of course. And continuing on that story, so I was interested in being able to offer information to clients whenever I was consulting with them. And I realized, because SeniorCareAccess was not the only data provider, but SeniorCareAccess, as well as other ones that are out there right now, only offered information from those companies that paid to have the information offered. So although I looked at that information and then I did my own research, I questioned, well, why is all the research, my results from that research, not in these directories? And that's when I realized that it's a paid directory. So when Esther approached me and started to share about SeniorCareAccess, inside I was just boiling. I was like, oh my God, this is fantastic. She's created an unbiased database, something that professionals could access, something that professionals would get certain criteria of information that isn't normally available on these other data services. And it excited me because this is what I was looking for. And, you know, Esther will explain the same story, but towards the end of that initial meeting, I had said to her, listen, if you're open to it, I think you could make this site a whole lot more than just a data site. And I'm sure she was taken back by that a little bit, but as she mentioned, we went through a bit of a business dating period. And I had explained to her the other aspects of the business that I was experiencing with seniors in transition. And that involved all kinds of things outside of just actual real estate. So whenever I was consulting with families, that consulting aspect would entail all kinds of scenarios, whether it was aging in place, whether it was mom or dad is coming back from the hospital, whether it's we need to move into the house with mom and dad because they need us there, to what we call silver divorces. The kids have left, husband and wife are now older, and they've decided, okay, that's enough of that, and we're going to get divorced, and what does that look like? So I was really consulting on a wide range of scenarios. And then the other challenge I had was when I was building my network of professionals, which many of you offer services like that, there was no resource for me to access to find where you guys are, and that was frustrating. That was a huge time requirement on my side. So I literally spent over 9 months trying to build my network, and at the time I lived in Mississauga, so it was meeting people, doing presentations, connecting, et cetera, et cetera. And when I presented the idea of what SeniorCareAccess could be, my opinion, of course, Esther was like, oh my God, that sounds fantastic, because that's what I would like to build as well. So that's really what set us moving forward in building this very, very unique portal. Esther, I'm just going to keep going here, and then we'll get into the database piece. So what we wanted to do was create a very simple access point for professionals to use. Now, I say professionals to use because right now that's the target market for us, and I'm going to tell you why that's the case. But later this year, the website itself is going to open up to be a public access site as well. Anybody can access the site, but the way we've designed it is we're targeting professionals first. Okay. Now, let me explain why it's the professional side of things. When I was networking, and as I continue doing my business, and as we offer training and we bring on other professionals in understanding working with seniors, I had spent tens of thousands of dollars on marketing, especially in the real estate industry. And any of the realtors on here, you'll agree with me, I'm sure. And the challenge was, if I'm going to market myself or market my service, where could I find where the seniors are that needed my service? And at that point, it was very difficult to find out where they are and how I'm going to do that. And in my networking, I came to the realization, as some of you have, is there are service providers out there that are marketing, that are getting in front of senior clients and their adult children, but they fall short in transitioning them to additional services, meaning they end up staying in the silo of service that they offer, and they don't have the resources to call upon, the other professionals to call upon, if their client might need additional sources. Okay, so with that, if we target professionals such as yourselves, and we offer a certain level of service or involvement for you and your clients, Now we're exposed to the seniors themselves and the family members. Now, we don't do what you do specifically, but by bringing the other service providers to your fingertips, now you're able to network and market accordingly to a senior demographic, okay? And the way we looked at this is there are three main factors when we're dealing with an older adult going through a transition. And the first one is housing, right? We need shelter, we need food, we need health. So we don't touch on the health care side of things. That's a whole nother government agency and aspect of the business. But we do deal with the housing aspect. And because I am a Master Accredited Senior Agent, we do a lot of work regarding housing. And we have a network of realtors across Canada that we work with. And Esther came forward with the database, and we worked on having an unbiased database. The database, the housing database detail part of this is really designed for a professional to use, okay? Esther, do you want to explain why it's targeted for a professional's use and their understanding of it? Might be a slight delay there. Esther?
Hello?
There you are.
Now you can hear me?
Now I can hear you. Go ahead.
Okay. All right. So there are so many levels of care out there. And more, I find that people just don't know the difference. So in order for this to be a really effective tool, it needs to be worked by somebody who actually knows the difference between a retirement home, a long-term care home, a life restructure, a seniors building. People don't know the difference. The general public doesn't. However, professionals usually do. So if a professional is accessing it, they will know how to filter the data. Right now, we have in excess of 5,000 properties on this website. Unless you know what the different levels of care are, you're going to go down a rabbit hole and get lost. But a professional would know that difference and would know exactly what to click to instantly find the answers that you need.
Awesome. So let's hold on that thought for a second. So because of that rabbit hole that Esther's referring to, it's not a matter of, oh, it's a retirement home, is a retirement home, is a retirement home. If anybody's in this business, you know that they don't offer the same thing from home to home, okay? We also run into, and it happens a lot, even on a professional level, a misunderstanding of the different housing types, right? So some people still call it an old age home. It could be a retirement home. It could be an age in place, co-housing. It could be long-term care. People don't understand those differences, okay? Now, some of you on the call maybe have a clear vision of that, and that's great. But typically, in order to access the amount of data, it's typically a professional that gets it or understands that. And that's the difference of our database compared to, say, the competition who just puts it out there and says, you can just search for retirement homes and here are the results, okay? Now, we're going to come back to all of this. So I just wanted to give the breakdown of the 3 entry points into the website. We have the professional access of housing data or housing details. And we also recognize that families struggle the most at the very beginning of a transition. And that's where families may receive a diagnosis, they may receive information, there may be a circumstance that's occurring, and all of a sudden the family is thrown into this chaotic navigation process where they are putting their life on hold, and now they need to learn all of these things in order to get care or transition or housing or pre-funeral arrangements or some sort of health care, aging in place. Families aren't designed to know all that information, and they're seeking help. So we've created the consulting service that allows family access to a consultant, which helps them get them through that initial phase of what's going on, what's happening, who do we call, where do we get help from, what do we do? Okay, so we're talking about professional housing details, we're talking about consulting for families, and then we have the Senior Service Partners database. And this is where, when I was doing my marketing, I was challenged to be able to put myself in certain publications or areas of marketing where other professionals will be able to find me. Up to now, I think there's a fundamental shift that's happening right now in that traditional marketing and advertising isn't producing what it used to produce. So for professionals to find other professionals, or for the consumer to find a specific professional in their community, there is no database or directory for that. We are creating that right now. Okay, so between the 3 levels of entry or 3 levels of service within the site, we are able to cover the professional involvement, the professional networking side, and the assistance to families. And because we have those connections across Canada, we're able to work with Canadians across Canada. Okay. So if you were to click on entering either of these, or if you went up at the top bar, the top menu, you'll be able to access it as well. And then these 3 videos just below them gives you a quick rundown of what the entry requirements are for each section, who can use it, how it's used, etc. Okay. Esther, we're going to get into the housing data now. And Esther keeps
having
muting.
issues.
There you go. There you go.
Now I'm okay?
All right. Yep.
Okay.
So let's get into a search here. We're going to show you how this search works, and you can talk about the membership level as well and how that works.
Okay. Okay. So, Paul, can you select, so you can search one of 2 ways. Either if you know the name of a home, you can actually just do a quick search. Well, it's not gonna, yeah, there's no, you spelled it wrong, but yeah, okay.
Of course, that's last time.
Okay. Okay. So either you can do a quick search, or you can go into an advanced search, which is probably where most people are gonna use it. If you are unaware of what the different levels of care are, if there's a question, we have a document that explains each level of care listed. We also have a video that will describe how you would do a search if it's the first time you're searching. So Paul, just scroll up and we'll do a quick demo. We're going to search by province. So first, Ontario. And we're going to search by city. So if you can just put in Toronto. And Toronto, because of the size of the city, is actually divided into 4. The only other city we've done this with is Ottawa, and it's really these amalgamated cities that are so massive that people would, if you're searching, you want to know a certain area. So if we just go to Toronto itself, that's the central area of Toronto, more of the downtown core, and the areas that are not covered in those other 3 categories that are smaller, like what used to be Leaside, for example, would be in there as well. Now you can either search by a name or by a street. So if you know the name of a home, you can actually flip through there, but doing that is not going to narrow it down to what the level of care is. It's just going to be a list. The street is because a lot of the time people will come to us and say, I know of a home on Main Street. Can you tell me about it? And you're like, huh? I no idea. So this way you can type in Main Street and all the homes on Main Street in that city are going to come up. Let's just go through it to sort of show exactly what a basic search looks like. So you can select different levels of care, especially if you're looking, say, for a home that can manage people that are different levels. So a husband and wife, maybe one's retirement, one's long-term care. That would be the only time I would select multiple levels of care. And the reason is, the more you select, the more your options are narrowed. So you'll eliminate homes that actually may meet the criteria you need, but you lose that because you put too many things in. So you won't get that one specific home you need. It's almost better to search for more data than less data. So if you just select retirement home, Paul, and scroll down, and you'll see there's also other search criteria you can use. So for example, if somebody has a dog that they want to bring with them and it's mandatory that they bring this dog with them, you can select pets allowed. Keep in mind, any home that hasn't selected that they offer pet accommodation will not show up. And it could be that they do, but it's on a case-by-case basis, so you wouldn't really know. But this is if you have situations that you must have this criteria met, that you would use the multiple. We also think it's important in our changing landscape that Canada is, that we have the question about culture and languages, because more and more we're seeing people from different cultures needing to access housing for a loved one, and they need a place that speaks their language, or that caters to their menu, or that caters to their culture. So these are questions that we do try and get answers for as well. And then there's the price range issue. So all of these things are ways in which you can use the search. We're just going to do a basic search, though, for retirement homes in Toronto now. So it would take about 2 seconds for you to select retirement homes for Toronto, and you've now got 28 options that have come up. And that's an awfully quick search, and it is every possible retirement home that we've been able to find in the Toronto area. And we have in our database over 350 fields of questions that we ask. And the reason is because we're covering so many levels of care, we want to cover possibilities that meld together different things. So while we have all those questions there, nobody's going to answer all of them because they don't apply. But it's available there, so we can list so many different levels of care. Currently, our database has in it all retirement homes across Canada, all long-term care homes in Ontario, seniors buildings, supportive housing, a whole lot of life lease. We're still building that. We will be extending that to 55 plus communities, senior friendly condominiums, palliative care, and eventually some group homes as well. When we finish Ontario, we'll be moving out west, filling up out west, and then moving out east. So our focus right now is Ontario for the next few months until we can get all that data together. Paul,
let me jump in just before we open it up. So what you're looking at here is an unbiased database. And you heard us talk about that at the beginning. If you are, let's say, looking at SeniorCareAccess, which some of you are quite familiar with, SeniorCareAccess, if they have a housing solution in that database, that means that result has paid to be there. What we've done is we have not charged these homes to be here. We have done the research and included the homes. Okay. Now, the information that we've added in here is our information that we've confirmed to be in, but the home itself has the opportunity to update the information. So each home will have access to their own file where they can add the updated information or make changes accordingly. Okay. Now let's look at this as a consultant. Okay. Now we have a wide range of professionals on the call today, which is fantastic. We're between consultants, ASAs, CEAs. We have caregivers. I know there's a couple of retirement homes on here. Senior service providers, estate planners. I know there's a medical supplier on. There's downsizers. If you look at when you're in front of a client and that client is looking at a senior housing option and they say to you, hey, do you know of something that might be a good fit given our situation? Up to now, you have one of two choices. You either say, no, I don't, but let's continue with the business that I'm offering you. Or you can say, I do or I don't, but I can help you find something. Okay. And then that search that you start to do typically is going to be a biased result unless you are very, very active in your community and you have personal contact with all of the results for that community. But typically a service provider wouldn't have that extent of knowledge of senior housing options. So as a professional, we've now developed this database, which is unbiased. And you're now able to either offer the consumer or the client the opportunity to gain that information and make an informed decision, or you can help them gain that information so that they can move forward with contacting whomever it is that they need to transition with. Okay. Okay, which one do you want to open up?
Let's do, how about Forest Hill Place?
Forest Hill Place.
So,
good one.
This is just showing you how much information we're collecting. Just briefly, some of you will notice that on this home, there's brackets that say vacancy. So we are test piloting a vacancy program with retirement homes. The idea here is retirement homes have free access to go in and update and enter information. We'd like them to tell us if they have a vacancy in their system. And that's because if you are working with somebody that needs a bed somewhere very quickly or room somewhere, it's a lot easier if you know that there's something available when you're making your calls. So it's an option that we've opened up to homes, but we are still in testing phase for it to see what the uptake of it is among the homes out there. So that's all you're seeing there. So every home you will see contact information and the type of resident they accept. So right off the bat, that's what you're going to see. Now, members do have the option to print, but all that will print, and this is for a couple of reasons, all that will print is that contact information that Paul just showed you. So if you favorite any homes, it will allow you to print or to put it in your favorites box, or both. So what we're thinking is, the thinking behind it is that, especially if you're a social worker or somebody who's working with somebody that needs a home, what they want to do is find a home and go visit it. So what you would be providing them with is contact information so they can go and have a tour. We don't make the rest of our data printable, partly because it has taken us years and years to collect it, and we don't want anybody going ahead and reproducing this website and taking away from the work that we've created it with. So that was that contact info. You see very quick at a glance information, which often is stuff that you need to know right away, especially if you're, again, a hospital social worker. You would want to know what you need prior to moving in so that you can get working on this in advance of everything. We have created a generic application form that can be used to get the ball rolling. We will be allowing homes to upload their own PDFs shortly, but for now we have a generic form that's a combination of several forms that we found that covers all of the social and a lot of the physical stuff, but not the medical information. Each home will have their own medical form that needs to be completed. And then we get into the kinds of care that are offered. And in some cases, people have provided us with pricing, and some they haven't. That's the one thing that will probably change from year to year. Otherwise, a lot of the information here will be stable from one year to the next. So here, this home has independent living and assisted care. They do allow couples to share. They have different kinds of accommodation at different price ranges. We do know how old the building is, who owns it, how many residents it takes, which gives us the idea of the size of the building. Some people prefer larger buildings. Others prefer a smaller, more intimate community. We know they're licensed. All retirement homes in Ontario must be licensed by the RHRA. And we know that they are a member of their organization called ORCA. They're close by to certain amenities. The language spoken is English. We know the culture they accommodate are Jewish people. We know all about their meals now, the menus they offer, and all the amenities that are in the building. So a lot of stuff there for people to utilize. I've had people that have said it's mandatory that they have a swimming pool. So if that's what you need, you would find this under the building amenities. So they don't have a swimming pool, it's not listed there, but they do have certainly many other amenities. Then we get into staff. And so this explains some of also, when you see the kind of detail, this explains why it's a professional that would access this data, simply because there is so much and there's so much to sort through. Once you figure out the level of care, you then have to determine what are the needs of this person and can this home meet those needs. So this includes all kinds of staff services and healthcare services that are available. And then we get into what's in each suite and the pets. Now we have a link to the RHRA for all Ontario homes where you can actually check the register to see if there are any issues with the home that have been noted and if the inspection reports are showing anything. For long-term care, they are inspected by a government body as well. But other levels of care are not necessarily inspected by anybody, nor do they need to be licensed. The other really unique thing about our site that no other site has done is if you are a member, you can now create a note. So say you've gone to visit Forest Hill Place and there's something you want to remember about it. This is where you would put it in. It gets saved. Only you ever see it. And it gets saved into this home's information. So very personal stuff can be put in there. I would never put anything about a specific patient, but in general, things that you want to know to remember the next time you're pulling this home up. And this way you're not, I know, often we make notes on all kinds of scraps of paper and different files. This way, everything related to retirement homes are all going to be in one place for easy access and reference. Okay, Paul, you can really stop typing now.
Okay, then I have to do something.
Paul really loves this section. He absolutely loves it.
When I was actively transitioning people and I was visiting homes, this was something that I didn't have access to, and I had it in my notebook. And I was there and I was taking in all kinds of information about the home, not only the personnel or the person that I was dealing with, not only the interaction with the staff. If I entered the elevator and the cleaning staff or nursing staff was there, were they chatty? Did they say hello? Did they welcome us? It's all of that. And that's what gave me the feeling of the home. So yeah, to me, this is exciting because it's hard for us, especially if you're doing a lot of that, to remember certain things about certain homes. And to be able to come in, make a note about that home, and that home is within your community. Now all your notes are here. You don't have to, bring your book and reference back or trying to remember or anything like that. I think it's a great tool. I wish I had it, right? So I like typing in it.
Yeah. So that's sort of a quick summary of how you would access data on the site. The heart. So now Paul is pressing the heart. This would allow him to print off contact information, as well as say that in his favorites file. So this is, as you can see, very intricate, very much professionally based. As Paul mentioned earlier on, over the next few months, we are going to be creating another section of the site that will be a consumer portal where they won't require membership, but where the homes that are part of it will pay to be part of it, so they will be the bias database. So that bias piece will be there, but by the same token, the information will not be as extensive and as professionally based, and it will open the site up to consumers as well in a bit of a different way. People who would like to have access to this data can become a member. We have different membership levels, and based on whatever your needs are, you can choose bronze, silver, or gold. And it's made so that you can just fill out the form and automatically it goes through, you get your password, and it's very quick and easy. We've automated a whole bunch of stuff on the site.
So let me explain the different levels here and who might be using it. So we've been talking about the biased, unbiased database. And we talked about the professionals who would understand senior housing levels, especially levels of care. But to the consumer who doesn't understand that, they don't know what they don't know. So in order to just give them access to all of this data, it's not useful for them unless they're working with a professional to explain it. The second part of that is we don't want to exclude the consumer from using this. So we've created the first level, the bronze, which will give them 30-day access, a maximum of 25 searches at a $99 cost. Who would use this? So if you as a professional want to use it and you have a specific client, this is not something you're going to do every day or every week, but you need to help this client with it, you can buy in and access that database at $99. If the public or a family member, right, wants to access the data because they're confident that they can get a list and then walk in, ask for a tour, and follow up specifically about those certain homes that they've selected, they can also buy in at the bronze. And because they're not going to be doing this all the time, they only need it for that, that limited use, and coming up with 25 searches for an area that's pertinent to them is more than sufficient. But the amount of information they get, they're going to walk in there educated. Okay. If you're a professional and this is something that you do often, I can tell you that the retirement home would much rather see you walking in with a potential client than just a client walking in and asking for a free tour. The way they look at that potential business is very, very different because you as a professional are now escorting them in. Okay. So these are the three different levels to access the database as a member, as a professional member. Okay. Later in the year, we will be opening up, as Esther mentioned, the SeniorOpolis version, which will be open to the general public, but that would be biased because those that are going to be listed on there are companies and organizations that pay to be listed. And because they pay for it, then that list, although biased, is free to the consumer. So now the consumer can decide, do they want the biased or do they want the unbiased? Do they want to work with a professional or do they just want to do it on their own? Okay, the power now becomes in the hands of the user. Okay, and we've really tried to keep, to be sensitive to the pricing and how it works out. And we feel that as a professional user, this is something, the silver level would be something that I would get into. For myself, doing a lot of consulting and transitioning, I would easily go into the 449 one. Okay, but that's up to you if you decide to use that. Okay, so let's go back to the home page. And let's get into this consulting service for individuals and families. Okay. Esther, you want to take it from here? Let's see where she is. Unmute Esther. There you go.
It's so weird. It keeps cutting out.
Yeah, I don't know why. As soon as you stop talking, it mutes you. So.
Yeah. It's tired of it's tired of my voice. That's it.
Very good.
There is the opportunity for people to come to us if they need some guidance. So it can be anything. It can be any form of transition. We're not just focusing on moving to a retirement home or long-term care home. People need help throughout different parts of their life, especially if they're a senior. And they may need help downsizing. They may need help. I think, Paul, you mentioned some of this already. Gray divorce. Yep. They may need an advocate to help them in terms of healthcare stuff. There's all sorts of areas that a senior needs assistance. So what we've created is a program where we have consultants with various backgrounds who've worked with seniors who can help walk people through different parts of the process. It's a lot of hand-holding. It's a lot of pulling resources together that can provide a service that somebody needs. It's that networking. It's that creating their own group of people that they reach out to help out with different things. So with this, though, it isn't a free service. Again, we are a for-profit company, and we do have to find ways to make money to pay for things like consultants. So there is a fee, and basically we've set it out as a base fee for approximately 8 to 10 hours of work, where we meet with a family, we create a plan of action, and work with them to fulfill that plan of action. If they only need us for 1 or 2 hours, there is an hourly rate that we would charge as an alternate. And basically, it would be a lot of the initial stage is finding out what their needs are, doing a decent assessment where we analyze exactly the kinds of services we need to bring in for them. And we are building that consulting team right now. So if anybody who's listening is interested in perhaps finding out more about becoming a consultant for us, please reach out, send us an email, give us a call, and we can explain more about that. Mm-hmm. What have I forgotten, Paul?
Yep, I'll jump in. As a professional, me working as a professional, I was willing to do this type of service. Okay, so when I was in my actively working in my real estate business, I would say to my clients, my senior clients especially, there's 2 parts to my business. One part is transactional. That's all the real estate piece, the paperwork, the requirements, the codes, the process, the submission of papers, the lawyers, all of that stuff. And then there's the what about you? And that part always got in the way of me doing my business of real estate. So then I realized that unless I could help the family deal with the what about you piece, those challenges that they were facing that were holding them back from moving forward, unless I could deal with that, I wasn't going to be able to get my business piece. So I started I started doing consulting years ago, and that's how I started to recognize that families are so confused when they're faced with this transition period. And I'm not talking about, a middle-aged person who has, great success, everything is going great for them, and they want to buy a big house and fancy cars. That's not necessarily what we're talking about. We're talking about when your father calls you and says, listen, something's happened to mom, she's in the hospital. Can you come? And then what happens after that? Okay, so you as a middle-aged person is now going to be the go-to person of trying to help mom and dad. And what does life look like from that point forward? And what resources are available to you? And who is out there to actually help you? Now, I don't want to, hound on this too much, but for most people, they've spoken to the doctor, they've spoken to the lawyer, they've spoken to the financial advisor, and they leave because that's all the services that professional offers. And they go home and they are as confused as anything. And we know as a professional, if your client is confused, chances are they're going to make bad decisions. So there are other consulting companies out there, and kudos to them. But what we wanted to do was be able to make it accessible and affordable to get them started. Now, we've had families or individuals go well beyond the first action plan, and we have other individuals that aren't quite ready for an action plan, but have taken this on an hourly rate. Okay, we have people that we've worked with. They ended up in the hospital, and the power of attorney was speaking with the lawyer, and the lawyer recognized that these people have no idea what's going on, and they wouldn't be prepared to receive the gentleman back home. They knew about our service. Lawyer contacted us. We got in touch with them, and we did an entire return home care plan for them. Okay. We have others that a partner for, their lifetime has passed, and the surviving spouse really has no idea how to move forward, especially the fact that their children are not local. We have others where the children, or rather the children are local, but the mother or the parent is in another province, and the children want to bring mom closer because she's getting older and needs more care, and they're looking for a real estate transitioning process where that professional would understand what that family is looking for. Okay, so we're able to touch on many different levels. It's not just about finances. It's not just about a retirement home. It's not just about family dynamics, although all of those things quite often play a role into it. Okay, so we have several consultants. They're all independent consultants. They come from various backgrounds and fields, and we're looking to expand this program. Right now, we're able to manage, especially because of technology, we are able to manage anything that we need to consult on via online. And if they happen to be relatively local or within the community of the particular consultant, that could also be a face-to-face meeting. Okay. Now, this is a great resource or a great tool for you as a professional. Why? What I said earlier was we're all in the silos of services. Bill, I know you're on the call and you were questioning about what I had meant by that. This is what I'm going to refer to. So let's say it's a realtor, okay? And the realtor, the only way the realtor gets paid is on a commission if they sell the property, okay? But in order for the family to make that decision that they're ready to list the property, what has to happen with the family? Well, there's a lot that has to happen, right? And just imagine how much has to happen. If the agent says, okay, they're not ready to sign the listing yet, I'm just going to leave my card and hopefully they're ready in 6 months and I'll call them back. Well, in my opinion, that wouldn't be the right thing to do. In my opinion, I would say, listen, I'm the professional realtor. I'm here. I understand. I know what you're going through, but what you're going through is not what I offer. But guess what? I'm part of this network, and there's a company and organization called SeniorCareAccess, and they offer a service that would help you get through in navigating and collecting all of this information that you need in order so that you're ready. I can come back in, sign the listing, and we can move on from there. The only thing that client is going to say is, oh my God, thank you very much. Okay. Now, what we've done is we've set this up to, you can just come to the website on your phone even, just come to the consulting section, you hit the referral form. It's all online. You just enter that information. We get the email, we'll do the follow-up. It's that easy, okay? Now, one of the questions that most professionals ask is, well, if I give you this client, you're going to take them and give them to another service provider who offers the same service I do. That is not what we are going to do. Absolutely not what we are going to do. We're here to develop the relationship, not take the money from you, okay? So by filling out this referral form, it will give us the details of who the referrer is, who you are, okay? And in doing so, we can allocate what service it is that you offer. And when we're working with a client, and if they require that type of service, you get your client back. We don't charge you for that. There's no referral fee. There's nothing. It's your client. So we're here to help them get through the process so that you can then plug in your services at the right time. Okay? So we've done this based on my experience in working with other referring companies and losing business because of something like that. We're not here to take the business. We're here to enhance the quality of life of your client and increase your position in getting the business later on if they're not ready. Okay? Again, this is a professional level relationship. Okay? If you just go back here. If a consumer is just going to come to the site and the consumer is going to get in contact with us and we don't know that it's from you, well, in my opinion, if I were you, I would definitely fill out the referral form so that at least we can keep track of it. Okay? Now, the consumer can come to this site, the consumer can come to the consulting, the consumer can engage with us. There's no membership required for that. Okay? But we don't solicit other businesses to pay for our service on consulting. And I'm here to tell you that the industry is up for a change and the government is up for a change and they're looking for alternative ways of offering services. It will end up that the consumer pays for services. The government is not going to pay for this. Okay? So this is not for everybody. We can't help everybody. We know finances are tight at certain times, but there is a fee for this service. Okay? The free part that you see in front of you is that we do offer a free 1-hour consultation just so that we can gather information to see if this would be a good fit with the client. Okay? And if it's not, it's not. If it is, we move forward to the next step. We deliver an action plan based on the information we gather. We meet with certain family members that have been indicated as pertinent to that plan. We'll work with the family. We'll give them an outline, and that outline should get them to the goal or goals. If it requires more than that, when we come back with the action plan, we will indicate that. The client will always know what they're paying for and what they're getting for it. They're also always in control. If they decide to stop at any point, they can stop up to that point and we'll just bill them up to that point. So although there would be a contract for the entire action plan, it doesn't mean that they actually have to follow through with the whole thing. Wherever they end up, they're just liable for that payment up to that point. Okay? And I know that's quite different from other services that are out there. Okay? Okay, so that should be an asset for you when you're dealing with clients. And we would like you to look at that as an asset, okay? There's also FAQs at the bottom here, which you can, open this up in front of your clients, or if you need to get a brush up on answering some of these, you can do so. Okay, okay, moving along. Let's get into the online store for a second. Esther, do you want to jump in on this one? Let's unmute you again. Okay, try unmuting yourself.
Okay.
There you go. No, you're muted.
Okay, so
there you go.
Can you hear me? Okay.
Yep.
So somebody's asked a question. Is it possible for you to educate us, professionals, of going through the discovery meeting ourselves, which will provide more value for our clients and save you some time?
Oh, interesting. So you want our information on how we do it, but you don't want your client to use us. Why don't you become a consultant for us? How did you take that? I'm reading it as the person wants to save us some time so we don't have to go through
that discovery, that free discovery. But, you know, for me, I think of it as an opportunity, that 1 hour opportunity for them to get to know us and us to get to know them. It's all part of the process, and to take that from somebody else and then say, okay, we're not giving you your 1 hour free now. We're going to now start charging from minute one. It doesn't make for good practice, and it doesn't make for developing a relationship and rapport with somebody. So to me,
I would agree.
Yeah, that discovery is all part of that relationship building, which is what we're about. I mean, really, everything we're doing is all about relationships.
And that's not to say that you can't do that on your own for your own sake and then transfer some information to us at the referral stage. But I would think that it would be very, very important that we have a chance to interact with them prior to moving forward. I mean, there's a lot of red flags that could pop up. There's a lady that I'm working with right now. Red flag is, I think she's looking for us to force her parents into writing a will and giving her full power of attorney for finance. That's my feeling from the initial interaction, right? So we never know what that family or that position of the individuals are going to be, and it's a massive discovery process that we have to go through to actually come up with something for them. Okay.
So let's get back to the publication. So we've created currently 3 publications that can be downloaded and used as tools. The other opportunity is we have the ability to make it into a marketing tool for people by adding a page with a full page ad in it and offering a license for somebody to use it for a year. And then they can send it out to different clients if they're in a business where they would use several of these. The first are visiting tips. And this is basically a document with every kind of question you can possibly come up with when you're touring a retirement home or a long-term care home. Different questionnaire for each level of care. And it's based on the 23 years that I've spent researching this stuff and building that whole SeniorOpolis side of my business. And so it's divided into observations as well as questions, initial questions for a first visit, and then additional questions as you go on more visits when you're starting to focus on this is the home I think my loved one would be best suited for. The second is a care planning workbook. This is an incredible tool. It's about 40 pages. And it really works well for either caregivers or a senior that wants to plan ahead in the event that they reach a point where they need a caregiver. And it has everything from health information to financial information to end-of-life instructions. Absolutely everything you could possibly think of. And it's all divided into sections. It's fillable online, or it can be printed and filled in by hand. Probably one of the most incredible tools for a caregiver to have. And the third is information on care options for seniors in Ontario. It's taken from a lot of the information that we gather together every year to do the annual publication for SeniorOpolis, but it's a section of specific information on what all the different care options are if you're living in the province of Ontario. So it's updated annually as things change and websites change and laws change. We update it every year. So that's
there are other publications that we have. We just haven't loaded right now, and there are a few that we are co-working with certain professionals, other professionals that are wanting to get publications out. Okay. Yeah. Okay, so I'm just noticing time here. So let's get on to resources. Now, we're all professionals. You heard me say at the very beginning, it was difficult for me as a professional to identify where to market. and my marketing I wanted the marketing to be targeted to seniors, but more so I wanted to be able to target it to other professionals that might be able to that might require my unique services for their clients. Okay, and in spending a lot of money on marketing and advertising, knowing what worked and what didn't work, getting Google first page results for many years, whether numbers were coming in or not, whether I did a full page ad in a certain magazine. We've all been there, we've all done that, and we have designed this piece to be able to answer all of the challenges that we were facing as professionals trying to market. So SeniorCareAccess's goal is to get in front of professionals who work the senior marketplace. By bringing professionals, I can tell you firsthand, it is easier to market to other professionals than it is to the general public. I also know, and I can tell you, most seniors themselves may not be looking for services. The support of those seniors will be looking for services. Okay, so I know there's a couple of people on the call right now who are looking at consulting and business planning. If you decide to spend your money and try to target seniors themselves, you better bring free cookies and free gadgets to give away. Because most of them say, I live in my house, I'm quite happy, I'm great with my medications that I take, and I'm not doing anything. I've also had people say, I don't even need a will. The rest of the family can deal with it once I'm gone. What do I care once I'm gone? Okay, so that senior themselves may not be your client. But I'm here to tell you that the other professionals that do come in contact with their adult children and the senior, that's a way better contact to have for other business. And again, those other professionals are there to deliver their services, but they don't deliver your services. So to be able to refer that client to somebody else who can deliver that service in their community is a great resource. And that's the basis of what we're going to share with you right now. Okay, so accessing this part of the website is free. Nobody has to buy a membership to this. You have access to it right now. Your clients will, whatever it is. Okay. But what we've done is, as a professional, or rather as a company, we want to have a national database or directory of service providers. But as a service provider or a searcher looking for those service providers, we would want to be very community-based. And the more focused you are, the better your results should be. So what we've done is we've created a built-in funnel system in our senior service directory. Okay, and we're going to go through that. So let's say you're looking for services to help your clients, or I'm looking for services to help me in dealing with my mom. I would come to this site or the page. I would select the province that I would be interested in. And right now, we are focusing on Ontario. It is the largest demographic, largest populace, and probably the greatest amount of resources available. But we will be opening this up across all provinces. Okay. So I select the province. I'm in Ontario. That's great. And now I'm going to select a city. Okay. And in this case, I'm going to select Toronto Central just because we were already there. And what happens is you get a list of category titles. Now there's only, I think, 10 here, 12. We are currently opening this up to over 160 service provider categories. That's how many services we have identified that would benefit a senior in some sort of transition. That is a massive, massive database. Okay. This year, January, we have taken on a marketing sales lead, Mitzi Dadoon. We'll get you her information in the contact section. And their job, the sales team job, is to locate, identify senior service providers and offer them marketing opportunities within this directory. Now, right off the bat, you're probably thinking, okay, there's going to be 1,000 downsizers. Okay, that is absolutely what we don't want to have happen. Okay, so let's just pick out of the category list here, real estate seniors. For some of you, you probably didn't even know that there is a senior-focused realtor division. So number one, now you've been educated, there is specific realtors that specialize in working with seniors. Okay, so that's cool. But what we've done, and again, we need to keep this as simple as possible, we've limited the amount of advertisers in each category, in each city, to a maximum of 4. So if you are a marketer or an advertiser in seniors real estate for Toronto Central, there is only 1 more spot available for advertising in here. Now, what does this do for the consumer? Well, number one, it doesn't confuse them. Esther and I were on a call with a European company yesterday, and we were going over this very fact of how confusing things are for individuals. And we pulled up a few websites that are plastered with advertising and have an unlimited result. And of course, all of those results are paid advertisers to be there, but it becomes so confusing for the user. How do you decide who you're going to use? So we've selected this as an exclusive 4-position option. Okay, so once the 4 options are taken, we can't put more people into this. So the consumer or the professional coming here and searching is going to have only 1 of 4 to select. Okay, now each one will have a banner ad. Each one will have a live link going back to your landing page. And we suggest that that landing page be very senior-centric. Okay, you have, I think it's 1,000, maybe 800 characters description to put in. You'll have a direct link for your email as well, and your phone number, contact information, address, whatever it is that you want to put in there. Okay. So in this case, there's Vivian Sharon. She happens to be a Pivotal Master ASA. Congratulations. We have Barry Lebo. He's also a Pivotal Master ASA. And we have Magda Zezovic. She's also a Pivotal Master ASA. How do you make that decision as to who you're going to use? That's entirely up to you. That's your freedom of choice. Okay. But you can click on each of their links, see what they have to say and what they're offering, and then you can make that selection and make a direct contact with that selected service provider. Okay. We've also kind of copied the Google idea of the first set of ads are paid advertisers. In this case, the top ad, you'll see that it's slightly discolored or in a yellow background, maybe flesh tone background. Vivian has paid an additional fee to be always first, always on top. If she selects always first, always on top, the remaining 3 will be on a rotational basis. And that gives everybody below that area a chance to be in the 2nd position or 3rd position. There's also an upgrade for the 2nd position, because we've had people say, well, 1st position is taken, but I want 1st position. They can purchase always 2nd with the caveat that if always 1st leaves, they move into the 1st position. Okay. And that is a natural funnel system that is community-based, but has national implications. Okay. For me as an advertiser, this is something, it was designed specifically to combat my concerns about my advertising, especially as a realtor. If you open up the newspaper, if anybody still reads the newspaper and you go to that center page, there's 100 realtors, 100 houses. nobody looks at the details of the individual. They're just looking at the house and the price. Then they might do a phone call or an email. But in any kind of advertising that we typically do, are we really targeting our market? And again, if we're targeting professionals coming to the site, you as a professional can help your clients by saying, oh, okay, you need a family lawyer. I mean, I'm sure we all know one, but maybe you don't. Or you need a healthcare agency in your area, okay? Or executor assistant services in your area. Go ahead, do the search. Right now, there's only one person that we have in this category. That's open for 3 more to be in here. Okay. I know it's a lot of information, but if you're planning on doing any marketing, advertising, if you want to position yourself, we suggest you get in contact with Mitzi, who does, let's get this, who's in charge of our sales program, and she'll be able to help you and guide you through all the pieces and what's available, et cetera, et cetera. Now, everybody's probably asking, there it is, how much is that advertising, right? Perfect question. So let me just go back. Let's pull some up and let's take it again. Right. This ad, the single ad, is $8.99 for 1 year. Now there are upgrades to it. Esther, you can jump in on that pricing because it leaves me right now. I think the always first, always on top is $3.99 additional. Okay.
Can you hear me?
Yep.
Yeah. Okay. Can I just add one thing though?
Sure.
The cities, the list of cities. So the city list is based on where there is housing. Everything is functioning in the same way. If you could see, if you were watching when we were doing the demo for the housing piece, is exactly the same city distinction.
Right.
So wherever there is any kind of senior housing, we're open to fill in the senior services that also exist in that area. So so because of that, we have in Ontario, Paul, close to 400 areas that you can be in, right? So that was the one thing I wanted to say about the city list.
Yep. Thank you.
So yes, so always first is an additional $3.99. Design fee is $99. If you have somebody that can design it, we would just give you the specs and you can send us that. And if you want more than one city, there is the opportunity to take 2 additional cities at $199 each.
Right.
So you have to have that first $8.99, and then you can be in 3 cities for $8.99 plus $199 plus $199.
Right. Now, we've shared this business model with lots of people, business people, and they said, why would you give your other 2 cities at a much lower rate? Well, number one, we're not trying to be greedy with it. Number 2, we're already extremely competitive with competing advertisers. And number 3, as a professional, especially in Ontario, we may not just work in one city. Even if you're on the outskirts of the GTA, you may be able to offer your services to 3, 4, 5 neighboring cities. So really, are you going to get bogged down with only Mississauga? But I can go to Oakville and Etobicoke as well. So in this case, you would buy Mississauga being the main city at $8.99, and you have the option of 2 additional cities at $1.99 each, which is obviously a huge savings. And then you're in for 3 cities for that price.
Okay, Paul, I have a few questions that are coming through the chat.
Yep, go ahead.
Okay, so we talked about pricing. Somebody wanted to know pricing. If you want more details, you can email Mitzi it's Mitzi, M-I-T-Z-Y, at SeniorCareAccess.com, or you can email Paul or myself and we can forward it to Mitzi. The pricing is the same in every city. So the question is the pricing the same in Toronto as Milton? Yes. It doesn't matter what city you're in. The first city is the $8.99. If you want Toronto and Milton, it would be $8.99 plus $1.99. And the third question that I'm seeing is, can cities be in different provinces?
Yeah,
So,
each province has a list of cities. So
has a list of cities. I'm just trying to think back to how the insertion piece works.
oh,
So,
I see. They're saying if they buy a city in Ontario, can they get a second city in Calgary?
yeah.
Right. That's a good question. I think the answer is yes.
Not through our back end, because you first select your province and then you select
right,
your
because you have to select the province. You're right. The answer
right.
is no, because although it's a national program, we're trying to keep it very community based. So because you're right, Esther. So because you have to pick your province first. Let's see if I can go back here. Let's go back to resources. Because you have to select a province first, the cities are only going to show up for that particular province. So the answer would be no. So Jill, I know you're in Calgary. If you do advertising here in Ontario, you would have to choose another ad starting at $8.99 for Calgary or Alberta.
Mm-hmm.
Okay. And Jill, I'm going to be talking to you because I'm coming out to Calgary next month, and hopefully we can have a cup of coffee. Okay.
So another question is, what are the most common transitions that the active 55 seniors go through? Is there a most common transition?
So at the 55 to 60 range, they're still very active, and they would actually upsize properties so that they're closer to their families, to the grandchildren.
Or downsize.
Or downsize. But I mean, it could happen either way. But it all depends what you're defining as a transition, right? So for us, the transition doesn't mean it's a physical move from their house into something else. For us, the transition is there's a change in lifestyle. They may decide to age in place, but it's based on a change of something, right? The circumstances, whether it be health, finances, whatever that motivation or is causing that transition, it could be anything, right? I'm not sure if I clearly identified that answer, but our transition term is very different than a physical transition. I mean, there's lots of 55 plus active communities. Does that mean the majority of them are going there? I don't see it, right? The condo industry has a huge following of 55 plussers, right? Why? Because they don't need the big house and they don't want to do the work, and they feel that in this position in their lives, they want to have more free time to do the things that they now can do. But I know lots of 55-year-olds that are having major health concerns and they're not going anywhere. Yeah. Right.
So, and I had another question a bit earlier on when we were doing the housing piece, that was, is it possible to search on a map basis? The way we've set it up is postal code and how much mileage around that postal code. So you can select if you want it within 10 kilometers or 25 kilometers. Right. I find that when I'm trying to search by a map, it's a really difficult thing to make it large enough that I can actually find exactly where I want to be. Whereas if you do it by postal code, you can be more accurate. And that's why we don't have it as a map display, but instead, if you want to live by within 10 kilometers of your kids, what's the postal code of your kid's home? And then let's search 10 kilometers around that area. Mm-hmm. So that was the other question that came through.
Yeah, so I'm not sure, in adding to that answer, I'm not sure as a professional professional consulting helping a client, that a map search would necessarily help me, because the description or the details of that home or housing solution, I would already be looking at very specifics related to that person. One of which would be, where do you want to be? Right. My biggest question when I'm physically transitioning somebody is, forget everything else. Let's say everything worked out. Where are you going? Oh, well, I really don't know where we're going to. So is Calgary good? Oh, no. It has to be here in Ontario. Okay. So Northern Ontario? No. It has to be like, within Toronto. Okay. So like Scarborough? No. It has to be. Okay. Well, they're kind of telling you where they need to be. Now you need to fill in the criteria so you can actually locate the property. Right. I mean, it happens all the time. That's just the way it works. Okay. Okay, we're getting close to past wrap-up time here. Just one more thing on the article library.
Yeah.
So if you advertise on the site, we also want you to get stickiness from the site. And we're allowing you, for each ad that you put in, each $8.99, the main ad that you put in, you're able to include an article in our article library. Okay. The article itself is not an advertisement. It has to be information-based. But at the bottom of the article itself, let's just pick one here. Wills. At the bottom of the article itself would be your contact information, and that would stay on the website.
And it would have your website, so that Google would find it. Yeah.
Right. Okay, so it's a backlink as well. Okay. Now the article section is free to access to anybody. So clients, yourself, whatever it is, if you want to do that. But it also positions you as a more professional, because you're able to add an article in there. Not everybody is a writer. Not everybody is going to do it. We get it. But we want to be able to have the community members actually building the library. Okay. Okay, so that pretty much sums up the website itself. There are some major components that are coming out later this year. We're not at liberty to share that yet. We're in negotiations right now. One of which will be a complete game changer for many people, and we're really excited to be able to work on that. And at this point, if anybody has questions, concerns, or comments, if you want to just add that in the chat box, we'll be able to answer that. If you find that at this point you're good and you're going to be leaving the webinar, we'd like to thank you very much for your time in sharing that with us. Our contact information obviously is at the back end of the site here on contact. You can reach us there. And if you know Esther and I personally, you'll know how to personally reach us as well. But by all means, we'd love to hear from you. If you're interested in advertising, by all means, let's get together and talk about that. And Mitzi would be the lady for your assistance in setting up the advertising and the details for it. She'll be able to send you information. Okay. Awesome. So let's open it up for questions, which have been great up to now, but there might be more questions. I think we did such a good job. Nobody's asking any more questions.
So all of our contact information is at SeniorCareAccess.com, and we've made it easy. Mine is Esther, Paul's is Paul, and Mitzi is Mitzi. So you can reach any of us through those emails.
Okay, we'll hang around for a couple more minutes just in case people are typing right now, and that would be great. We'd love to hear from you as well. If you're interested in becoming one of our consultants, by all means, reach out to us. If you know of somebody that would be interested in becoming an independent consultant, get them in touch with us. We'd love to speak with them. Again, access to the site, advertising on the site. So that's what we're here for. Thank you. Thank you, Jill. Thanks, Bill. Thanks, BA. I feel like I should sing or something right now.
Oh, somebody sent us something.
Awesome. Thanks, Steve. Okay, I think that should be a wrap for that. If you'd like to get in contact with us, by all means, go to the website. All right. Thank you, everyone. We'll talk to you soon. Cheers.
Bye, everybody. Thank you.